Cancer of the rectum is an unfortunate, sinister diagnosis. Yesterday, a patient comes to me after a failed surgery for piles. And on evaluation, clinical evaluation, we find that it was, in fact, cancer of the rectum. My team of doctors, residents, they were surprised that how could somebody have operated upon cancer rectum thinking it to be piles. You see, I shared with them, I shared with you all for the last about more than 35 years. I've been seeing patients and treating them for cancer of the rectum. And I share with you that all of them have come to me with a mistaken diagnosis of piles. So that's how I carry forwards my talk on piles today. For an unsuspecting, unaware population, anything happening in and around the anal canal, the anus, is called piles. People come to us with either bleeding for rectum or pus discharge from the rectum or pain in the rectum, and they call it piles. Uniformly, all of them. And by practitioners of alternative medicines, they or unsuspecting, even doctors and surgeons, they've been treating it as piles for months together. Because this disease, cancer of the rectum, it masquerades as, after all, piles only. So, on clinical evaluation by an oncologist or by a surgeon who knows the subject, by finger examination, we come to know that this is not piles. So to say, this is not hemorrhoids or fissure or fistula. It is instead, it is in fact cancer of the rectum. So today's talk, I will focus on how do we evaluate and how do we treat cancer of the rectum in 2024 based on evidence-based medicines, international protocols. So by a finger examination or by an MRI or by endoscopy, we establish that this is a tumor of the rectum. Take a biopsy and prove it. Then comes the question, how are we going to proceed? Two questions arise: whether we are going to give chemoradiation or called neoadjuvant treatment first and then operate, or are we going to operate first and then think about what to do next? This is one question. And the second question is, will we be able to preserve the natural passage, or will we have to alter the natural passage and make it on the side of the abdomen? Now, what decides these two things? You see, any and every late stage cancer rectum will require a neoadjuvant therapy. Till 2023, we were giving chemoradiation of about 5 to 6 weeks, and 8 weeks later, we would take the patient for surgery. Today, in 2024, the protocols have changed, that we give chemoradiation first, all advanced cases of cancer rectum, locally advanced cancer rectum. We would give chemoradiation followed by half the course of chemotherapy. That means about 16 weeks, 12 to 16 weeks of chemotherapy first. Then evaluate. 30% patients will never require surgery, 30%. 70% people will still require surgery. So this is the treatment of advanced case rectum cancer. If they're a very early stage, then we do an upfront surgery but that's where we do just a local surgery where the normal passages and everything is preserved. Well, so in an advanced case of cancer rectum, where we have to remove the anal canal, that means the tumor is so far low down that the anal canal will have to be sacrificed. That's when we have to make a passage which is on the abdomen. The passage for stools is made on the abdomen. This is called a colostomy. It will be a permanent colostomy. People lead a normal life even after colostomy. So we try and avoid making a colostomy, but we can't avoid if the lowermost part of the rectum is involved. So these are the cases where the alternative passage has to be made, and a passage which is on the abdominal wall. People pass normal motion from there also. They don't always have to carry a bag. We teach them irrigation and they can be leading a life, normal functional life without a bag, even with a passage made on the abdomen. So, in nutshell, these days, by a finger examination and then by a biopsy, we establish the diagnosis. And then, if it is advanced, we give chemoradiation first, followed by some bit of chemotherapy, and then we evaluate. If there's a complete response, we keep them under observation. If there is a partial response, then we operate. And after surgery, we give the balance chemotherapy. This is how we treat cancer rectum in the present day scenario. Thank you very much for listening to me.